Hi, everybody. I'm Lisa Fisher. I'm your host of our first ever podcast for Arkansas Heart Hospital. I'm a longtime broadcaster here in Central Arkansas, and I'm a student. I'm someone who loves to study. I love to learn. I love what they do here at Arkansas Heart Hospital. I've talked about it for a long time. I'm here with my good friend and colleague, really, Michelle Rupp. To introduce you. You're familiar to people in Central Arkansas, but you really know your way around Arkansas Heart Hospital now, don't you?
I do. Just in the last couple of years, I am the director of PR and communications here at the hospital, and we have so much that's going on that is so unique to this facility as well as unique to the entire state of Arkansas. And the idea of being able to talk from the heart and explain,
I see what you did there.
Yeah,
that's
explain all the neat and innovative things that we are doing. This is just really an exciting platform.
I know it is. And our first guest is Jason Henry. He's here and he does the sleep studies. You're in scrubs, so you do something medical, right. But what are the letters at the end of your name or something that makes you special here?
Right. Okay. So my title is Senior Clinical Director of Ancillary Services.
Gosh, that's a lot of words.
And it encompasses a lot as well. So that I'm a respiratory therapist by trade. I've been doing respiratory therapy for over 20 years, and I've been at this hospital, at the Arkansas Heart Hospital, for 20 years.
Wow,
that's incredible. Since it began.
Pretty much since it began. But so it's been wonderful to me, and I've had a great experience here. But my title also is it includes the laboratory, the sleep lab, and pre-admission testing and teaching as well.
I always found it interesting. You were one of the very first people I met when I started at the Heart, and later it was told to me that, Jason handles all the sleep studying. If you're having trouble sleeping, you want to go see Jason. And I thought, wow, in a time where I'm always exhausted, I mean, what does a sleep study mean? And do I have to be at risk for sleep apnea in order to have a sleep study?
Okay. Well, so sleep study entails, it's a study where we come in and watch you sleep, pretty much. So you come in,
That's not creepy.
It's performed,
right, exactly.
It's performed at nighttime when most people sleep. We try to make the environment we set it up similar to a hotel room. So you come in and you're at ease and comfortable. You are hooked to some wires and, have some stuff. We watch your brain waves. We have a nasal cannula in your nose as well to monitor your breath, and a strap across your chest and your abdomen to measure your breathing. And pretty much we just watch you sleep and determine how well and how effective your sleep is, and watch for the primary thing we're looking for is people that obstruct and stop breathing when they sleep. And so that affects a large population within the country, probably 20, I've seen anywhere from 20 to 40 million people are affected by obstructive sleep apnea. And it affects also, it has multiple comorbidities that are also affected by sleep apnea. And by that, I mean, anything that you have else going on health-wise, sleep apnea can make it worse. So if you're not getting that good full night's rest at the end of at the night for your body to recover, if you have hypertension, coronary artery disease, anything that you have going on, if you're not getting if your body's not resting or recovering in the night like it should, it just kind of makes everything worse.
Well, forgive me to think that I've always just thought this was for the overweight person with type 2 diabetes, and since I'm not in that category, I'm good.
Right. Well, that's not necessarily true. So obviously, anatomy can have something to do with it. So you can be, 100 pounds and have your, a short neck and your anatomy is just right, and when you go to sleep, your tongue falls back and blocks your breathing off, and you have obstructive sleep apnea.
So is it always the person who snores or not necessarily?
Okay, so primarily snoring is definitely a sign.
Symptom,
so that's a symptom, and so that's usually the thing that triggers people to go in and have a sleep study. That, and they're feeling tired. Their spouse has told them, you snore. It's keeping me up as well, and I'm worried and concerned about you. The risk factors for sleep apnea are generally a male and gender, although females definitely can have sleep apnea as well. But if you're male, obese puts you at higher risk as well. Obesity is defined as a BMI greater than 30. If hypertension, if you use excessive, take excessive alcohol or sedatives to sleep, Smoking as well, family history of obstructive sleep apnea will put you at risk as well.
So being tired and fatigued, though we say that about everything in our lives, you really look at that as kind of the first step in getting treatment,
that should be your trigger to get into the door and see a doctor. So, you can't just walk into a hospital and say, I need a sleep doctor. You need to go sleep study. So you go to your physician, you tell them your problems, you give them, everything that's going on, and you say, hey, my wife or spouse has told me, that I'm stopping breathing at night. And
can you hear it then?
Well, okay, so generally snoring is the first, that's a sign.
Sure.
So that means that you've got some airway problems. Snoring is good. I mean, it's not bad, but it's not. If you're snoring, you're breathing. So.
Oh, you're alive.
The problem is
that's a good sign.
The problem is when you stop snoring.
Oh.
Yeah. So when you stop snoring, you stop breathing. So
sure.
Is it a gaspy kind of? That's how I kind of picture it.
Right. That's exactly right. So generally you're snoring, and everything's going along, and then the snoring will stop, and then it'll be a big gasp of breath. When that airway opens, because your body body's got to have that breath.
So what are some ways that can minimize this? Maybe cure is the correct word. Maybe it's not. But I know when I think of sleep apnea, I think of this big face Darth Vader mask on, and you're plugged into an outlet somewhere or something.
Right.
Is that the only option?
Well, the Cpap therapy, which is what you're talking about. So you go have your sleep study, you get diagnosed with sleep apnea, and then they bring you back generally for a second study, and they fit you for the Cpap mask. That's the gold standard. And it's a mask that goes over your nose. It may be nasal pillows that just go in your nostrils. It may go over your nose and mouth, be a full face mask. And what that machine does, the CPAP does, is it puts pressure in the back of your throat, keeps your tongue open, keeps your airway open, keeps everything moving and flowing like it should when you're breathing. And that's the gold standard treatment. So some people have trouble adapting to the mask. Like you said, it sounds scary when you describe it, right? Some people, they put the thing on, they get their first good night's sleep, and they wake up in the morning, they're like, how did I not just spend the last 20 or 30 years of my life without this, and they won't leave the house without it. The machines now are really small. They can travel, in a small suitcase, carry-on bag. People you can take them with you to the hotel. You do have to have power for the most part. So, I mean, even if you go camping, you go to a campground with, power outlet, and you're good to go. Other treatments would be weight loss. So if your primary problem is, if you're overweight, if you're obese, you get on exercise program, get your whole body in better health, lose some weight, and everything a lot of people can get rid of their CPAP machines at that point. There's also oral appliances, so you can which pretty much hold the jaw in a certain position to keep the tongue out and, from falling back and blocking the airway. Surgery, you can have your tonsils removed and some of the soft tissue that's in the back of your throat. You can have that removed. Yeah. So the gold standard though, CPAP. Everybody knows somebody that has a CPAP machine.
Yeah.
So.
Yeah. You're talking about it's always the spouse that's the one who's the tattletale, but you think about the person who lives alone, lives at home or wherever, and nobody's there to tattle. The cat won't tell you that you're not breathing at night. Right. So is their symptom then I'm waking up, I'm not refreshed.
Right.
I'm really tired.
Right. Well, a lot of times too, that's going to fall on the physician. So hopefully they're going to see a doctor on a regular basis, and a physical checkup. The doctor will, pick up on these signs and symptoms, and refer the patient for a sleep study.
I kind of wonder because if a lot of the sedatives, think about it, they're depressants, they slow you down. That's probably not the best thing for somebody who's having trouble sleeping through the night. Not that they need a stimulant, but it probably slows them down so much that they may not be cognizant that they're choking or sputtering or they're having trouble sleeping through the night.
Right. So the other part of sleep apnea is yes, you may get in bed, you may be laying there for your good 8 hour. Everybody should get 8 hours of sleep. Probably should have started with that.
I do better with 9 to 10 actually.
Whatever
I may yawn here.
It's never enough, right? So the recommended amount is eight hours. But if you're in bed, you're laying in bed for 8 hours, and your lights are out, you're not moving, you're calm, your body is resting. But if you don't get into that good deep REM sleep at night, that your body needs to recover and get rid of all the day that you just spent, with all the work and family and everything you had to do, your brain needs to get rid of that. And it does that through, deep REM sleep. So you got to clear that out. So if you don't get into that deep REM sleep, you're not resting. You're not sleeping like you need to.
So restorative sleep is not only good for your physical health, your mental health. I mean, think about all the benefits of it. Yet we're in a society that says, no, you need to work 16 hours a day. You need to be on your device for 12 hours of those days. And we know that the blue light, the blue light from our devices, I'm holding mine here, is something that keeps us alert.
Right.
There's so many things. Are there things then we can do at home? Should we use a sleep mask? Should we do the blackout shades? Anything to help us rest?
Right. So, yeah. So we've been talking a lot about obstructive sleep apnea, which is people, that stop breathing while they're sleeping. There's lots of other issues, sleep breathing disorders. So insomnia and just not being able to fall asleep,
right?
Is what is kind of what you were talking about. And so, we got to get off your phones. You got to set yourself a specific time at night where I'm going to turn this TV off. I'm going to turn this phone off, and I'm just going to read a book.
I'm asking for a friend.
Right?
How much time would you say between the time I check Facebook one last time and the time I go night? At
least 2 hours. At least.
What?
At least.
Wait.
Read a book.
2 hours. 2 hours before you're going to bed.
They still make books.
You betcha.
Okay. Oh my goodness.
With a hardback, a paperback.
Hey, Jason, do you abide by those rules?
I'm not good.
Okay.
No.
Pot, meet Mr. Kettle.
Do as I say, not as I do.
Right.
But that would be turning my phone off
at 8 o'clock
when I get home from work.
Oh, shoot.
Sure.
I mean, if you're getting home from work at 6 in the evening or 7 in the evening, and
you start
you try to wind down.
Right.
And
that's probably, this is more for people that are having trouble going to sleep. So those are the people, when I'm talking about when you're laying in bed at 1 o'clock, and everybody has a bad day when you had a stressful day at work and you can't let it go. So it's not just your phones.
Right.
It's not just the phones and the electronics. But if you, had a stressful day and you're just sitting there laying in bed, wide awake, thinking about your day and you can't let it go, you got to find alternative. You got to get in a dark environment. You got to remove all external, sound. Sound machines are great. I say sound. You want white noise. White noise,
yeah.
right? You want
which
it dark.
Your phone can provide, by the
way. But you want it dark, calm, cool environment with few distractions, and just relax. Yeah, read a book.
And isn't sleep maintenance something that's I think as a woman ages? Not that I know. Staying asleep is the hardest challenge for me.
Sure.
I can fall asleep because I get up early, so I'm tired at night.
Right.
But all of a sudden at 1 a.m.,
you hear
and then
a creak
at 2 a.m.
or
yes,
anything.
And then I'm up, and then I have trouble winding back down.
Right, and then that's where the sleep aids do help at that point. Right, yeah. So and they help you get to sleep, and they help you stay to sleep. So some people that's good. So you need to talk to your physician about that, and it may be right for you. Yeah.
Well, is that something that needs a sleep study if you're having trouble staying asleep?
It could definitely. And so the other part of a sleep study is we have their sleep physicians actually read the study, right? So we can also get you an appointment with them to talk to them about your sleep habits, dig a little deeper into what your problems are, because not everybody has obstructive sleep apnea. That's the primary thing. That's the primary reason we're doing sleep studies, but there are other reasons to do a sleep study as well.
What happens when you have someone come in and the night goes great?
Oh,
and maybe there's not any trouble if I'm waking up at 1 o'clock in the morning,
and then
I come here and sleep like a baby.
Right. Well, generally, we
could
always.
The
biggest problem we have is probably people coming in and not able to sleep. Because they're in a strange environment.
Do they take the sleep aid while they're here?
We recommend recommend you take what you normally would take. Yeah, right.
And try to replicate what you have at home.
Right, exactly. You want to create the same environment so that we're getting kind of a normal test. Yeah.
Sleep is so important. And again, I just think that our society has cut it out. I mean, we've cut back on hours. I know anytime I've talked to a physician about anything, they'll go, now, how much sleep do you get? I'm like, quit being so nosy. They're like, it's kind of my job.
Right. You go to Europe, they're going to take an hour in the afternoon and get them a little nap, refresh, and then they're more effective in the afternoon. That's America. We don't do it that way.
Right.
So.
And great here at Arkansas Heart Hospital, you have the physician, the team, people who are here who can help you find what kind of the root, because you want to know the root, what's causing the problems.
Right. And so a lot, I was talking earlier about comorbidities, and a lot of it is cardiac disease, and so we're our primary patient population is cardiac disease. So we have a lot of patients with atrial fibrillation, which can also result from sleep apnea or be effective or made worse by sleep apnea. And so a lot of our patients that are referred for sleep study, they are have other problems, and we are trying to mitigate the effects of the sleep apnea on their heart problems. So anytime you stop breathing at night, you're not getting oxygen to your brain, you're not getting oxygen to your heart. I mean, your heart has to work harder. If you're prone to going in and out of AFib, or you have AFib problems, it might take one episode to stop breathing, and you're back in AFib. So our electrophysiology doctors are big proponents of fixing sleep apnea if we haven't identified it.
So the $1 million question is, does insurance cover this?
Oh, insurances love this sleep studies. So as I said before, sleep apnea can make any problem you got, it makes it worse. Because if your body is not resting and healing, it just builds upon itself. So insurances right now are big on getting patients sleep study. Now, you do have to have it properly documented. So you need a physician visit, you need a face-to-face visit with a physician or a nurse practitioner or PA to document your signs and symptoms, and you need to order. And that's it. So,
and anyone can, wherever you are listening in, if you go to your local primary care, your local physician, but then you can request, I'd like to have my sleep study performed at Arkansas Heart Hospital.
Exactly. Yes.
Okay. Jason, thank you so much. How is your sleep at night?
My sleep's pretty good. I could do better about going to bed, shutting off the electronics, and getting length. My quality is good. My length is not so good.
You might sleep even better tonight having this recording over with now.
That's right. Yeah, exactly.
That's definitely true.
Well, thanks so much for joining us. It's been our first podcast here at Arkansas Heart Hospital. We'll be doing many more of these. And you know what? If you even have a suggestion or a question, we can definitely entertain those. Like I said earlier, I'm a student. Michelle, I know, loves to learn too. And we have the experts who sit across from us. So, Jason, thanks for being our first expert.
Thank you. I appreciate it.